Hello, everyone, and welcome, whether you're joining us remotely or physically from the room that we can look into from our side. Welcome to this session on the role of data and tech in the delivery of maternal reproductive health services. My name is Laura Lazaro Cabrera. I'm a legal officer at Privacy International, and I'm excited to be moderating today's session. I'm joined today by three fantastic panelists, starting with Alex Pirlo de Corbion, Director of Strategy at Privacy International, Naveen Abu-Ramila, a full professor of epidemiology and public health at Birzeit University, and Youssef Kader, a professor of epidemiology and biostatistics at the Faculty of Medicine in Jordan University of Science and Technology, and also director of the Center of Excellence of Applied Epidemiology at MNCHC. Youssef has published more than 650 scientific papers, and his areas of expertise include advanced epidemiologic and statistical methods, field epidemiology, non-communicable diseases, and maternal and child health. Thank you for joining us today. First, I'll start off with some introductory remarks from our panelists. Then we'll get into a discussion with them for about half an hour into the work they've been doing so that they can share a little bit more of their expertise with us. And then at the end, we'll be leaving 15 minutes of Q&A for the audience to jump in with any burning questions. Before we formally kick off, just a couple of general housekeeping points. Please mute yourselves if you're not speaking, and this goes for the audience specifically. There will be an opportunity for Q&A at the end, so if in the meantime you have any questions, please feel free to add them to the chat box and we can come back to those at the end. Similarly, if you would like to ask your question in Arabic, please feel free to do so. Two of our speakers are native Arabic speakers, and they should be able to respond to your query if you're more comfortable speaking in Arabic. And now, without further ado, I will now go around the table to ask the speakers to briefly introduce their work. I'll start with you, Alex. Why is privacy...
Hello.
Hello.
Sorry for interrupting you. I just need to highlight that I'll be leaving my table in case anyone have a question. Just make sure to turn it on. Okay. Thank you.
Thank you. So I'm turning it over to Alex to tell us a little bit more about why Privacy International specifically is looking into data and tech in the delivery of maternal and reproductive health services.
Great. Thank you, Laura, for the introductions. And it's great to see so many people joining remotely and also see a few people in the room in Beirut. I think we would have all liked to be able to join you today, but it's great that we can start with this remote event. Like Laura mentioned, my name is Alexandrine Pirlo de Corbion. I'm Director of Strategy at Privacy International. We're a non-governmental, non-for-profit organization based in London, and we work globally with networks and partners from around the world. What Privacy International works to achieve is systemic change by strategically targeting our tech, legal, and policy advocacy at governments and companies who are using technology and data in a variety of ways to determine, the future to their advantage and to vie for power. Today, I'll be specifically focusing on the work that we've been doing as part of our digital health work, and specifically our work on maternal and reproductive health care. And we've had the chance for the last few years to work with Naveen and Youssef and their teams in Palestine and Jordan, as well as with the University of Oslo as part of a project, but I'll let them share more of our findings. I'm going to use my time now to just provide a broad introduction to why PI has been working on this, but some of the issues as well that have been driving this work and that have informed our engagement in the region, in the MENA region. One of the first reasons why, Privacy International started to explore and work on the use of data and technology in the reproductive and maternal health sector is because there is a direct link between our mandate to advocate for the right to privacy and the enjoyment of reproductive rights. The right to privacy is often one of the precedents used to establish reproductive rights in many countries around the world. And the connection between these two rights exists because laws and policies which impede upon individuals' rights to access sexual and reproductive health services, may also interfere with individuals' rights to privacy, to be able to make autonomous decisions as it pertains to their health and fertility. It is within this framing that, we started in 2019, 2020 to explore further the consequences of the digitization of health on individuals' privacy, and specifically to look at developments that we've been observing in the reproductive and maternal care sector. Since then, we've been looking and researching a variety of data collection and data sharing practices, from period tracking apps, as well as other ways in which digital platforms risk being exploited to restrict access to or mislead individuals seeking reproductive health care. And we've continued to explore these issues to also explore digital tools and technology being rolled out in the maternal care sector. Some of the things that we were looking at were how some many governments and non-state actors around the world have continued to move rapidly towards the implementation of digital systems for strengthening health systems, including reproductive, maternal, newborn, and child health services, which is leading to a rapid increase in digital health initiatives, which are focusing on the processing of personal data. And in many instances, the intention is to tackle the ongoing concerns such as maternal and child mortality. And so what we've been trying to assess through this work is to understand how these developments in this sector have evolved, and to be able to also connect in terms of some of the risks that we've seen emerging and some of the safeguards which need to be implemented. Because without these safeguards, be it in the technology that's being deployed or in the policies and laws that oversee their deployment, if we don't have these safeguards, we risk potentially undermining human rights with issues around mission creeps or unregulated data sharing, or the failure to protect individuals' identity. But we also risk rendering potential benefits from these digital health initiatives to improve access to these services, preventing, non-scalable, unsustainable developments. And so the kind of initiatives, also as an introduction to some of the interventions that Naveen and Yusuf will talk about, we've seen a variety of developments and initiatives in this space, from healthcare information systems, electronic records. For example, we've been working with our partners in India, the Center for Internet Society, looking at India's mother and child tracking system, which is this system that collects data about pregnant women, children, and families from conception to around 40 days postpartum. We've also been looking at the use of SMS for appointment scheduling, for remote access to care, counseling, as well as the use of different applications by healthcare workers to track an individual pregnant mother over the cycle of her pregnancy, or a child, for example, in their cycle of immunization. So we've seen a variety of those developments, and as many of you will have followed with the COVID-19 pandemic, there's been a huge growth and acceleration of the use of these digital tools in the healthcare sector, as many people were not being able to, physically interact or be present to different healthcare facilities. And then prior to the pandemic, this was also prompted by some proximity issues as well, with people maybe living in rural areas and not having access to healthcare facilities. So there've been, various developments there prompted by COVID, but many were already initiated before. And I just wanted to also just introduce 4 areas of concern that we've been exploring as part of our research as well. The first one is around, the lack of a people-centered, comprehensive, human rights-based approach to decision-making, from conceptualization to the design and implementation. And, this has led us to ask question about does the digital element respond to the needs, of the people in the communities that will be using them in terms of ensuring better access, quality, availability, of affordability of care? How will it play out in practice with still huge issues around accessibility to digital tools and the digital divide that plays out very heavily in terms of factors around gender, for example. We've also seen that a lot of these digital health interventions are being deployed in a weak or merely emerging regulatory framework, which meant that crucial questions around, doing data protection impact assessments, how best to protect the data that's being collected, and setting the rules for those that will be engaging in these systems in terms of accountability, haven't been developed effectively. And where they exist, there are huge issues still around enforcement. The third one is around the involvement of the private sector. The involvement of the private sector has remained largely unregulated. They're either enabling governments with deploying digital health solutions or deploying their own. And there's vast amount of money being invested in the healthcare system as well. And then the last point, which I think will be particularly important for the discussion in the MENA region and in the case studies we've looked at in Jordan and Palestine, is sometimes the involvement of non-state actors. And that could be a humanitarian organization, a development organization that either works in collaboration with or on behalf of the government to deploy some of these digital health intervention in the reproductive and maternal care sector. So I'm going to leave it there for now with these introductory remarks, and looking forward to the discussion. Thank you.
Thank you, Alex, for that background on why Privacy International is looking into this and the reasons why some of the issues we've been spotting along the way. I'd like now to turn it over to Naveen and Yusuf to ask you, what is the current state of digital health in Jordan and Palestine? Maybe Yusuf, you'd like to have a first go at this question?
Yeah, thanks, Laura. Good for the audience. Good morning, good afternoon, and good evening. Let me talk about the status of digital health in Jordan. Jordan recently witnessed an increasing interest in digital transformation, and a number of digital transformation initiatives were launched in the health sector, such as Hakim initiative, which is the electronic medical records. It was initiated to computerize medical and financial patient files. Hakim now is implemented in 70% of public hospitals and around 30% of primary healthcare centers. The Health Information System Strategic Plan for 2019-2023 was developed in 2019. However, and to be honest, no significant accomplishments were achieved in the last years. In the last month, actually, a few weeks ago, a workshop was held to propose and develop Jordan's national digital health strategy with support from World Health Organization and in collaboration with the International Telecommunication Union. When it comes to the digital health infrastructure, including equipment, computers, supplies, softwares, devices, these are, in addition to connectivity, are still under-resourced in the country. The digital health governance structure is institutionalized. The Ministry of Health has a unit to deal with health information system, but the unit is not really active. Digital health is not included and budgeted for in the national health or relevant national strategies and plans. The law to protect individual privacy, governance, and sharing of data has been proposed, but still it is under review. There is no protocol or regulating or certifying devices and or digital services. And there is no protocol, in fact, to support secure cross-border data exchange and storage. When it comes to the interventions in the area of reproductive health, overall, the number of health interventions, digital interventions, are really is limited. And many of them actually include, of different types like health information system, surveillance system, registries, mobile application, or sending text messages, and educational website. The health information system here in Jordan is Hakim. Surveillance system, we have multiple examples. One is Jordan stillbirth and neonatal death surveillance system, which I was leading this project. We developed this initiatives, and it now will be scaled up, to include all hospitals in the country. There are, Laura, there are multiple challenges that are facing the management of digital system and infrastructure. Like there is no appropriate policy or regulatory environment. There is a scarcity of plans, programs, and initiatives that support the upgrade and sustainability of the infrastructure and IT communication system. Of course, lack of financial resources to support ICT project is really very in short. There is also limited internet access and limited health literacy in the country. Also, privacy concern and security risk due to unauthorized access to medical data is another challenge and issue.
Thank you, Yusuf. Naveen, is that similar to what you're witnessing in Palestine?
Very much similar, but I would just add, so I would build on what Dr. Yusuf has said regarding that we're witnessing this transformation. Everything is becoming digitalized, and this is why we started this project. And thanks to this project, we could see a comprehensive view of what's happening in Palestine. So when we started with the mapping, just to understand what's happening, we thought it was only one or two initiatives that we witnessed during our work with the Ministry of Health and other providers. But it seems that it's all over the country with so many initiatives. We have managed to identify like 200 initiatives, but the one that were really well structured and organized, there were around 11. So we have this transformation into digitalization at both levels, the primary healthcare and the tertiary healthcare, all in maternal health, but also in health in general. With this movement and quick transformation, we couldn't see a matching policies. Although we have different policies, but they're not matching what we wanted to see. So we could identify strategy for public health, for reproductive health, even for digital health, but they were singing alone. So the digital health is working on its own solo, the reproductive health is solo, and within the reproductive health you will see digitalization, but how you can merge or marry this with the digital strategy, no, there's nothing. And also the disconnect is not at the level of the policy, but also at the level of implementation and practice. So each people is doing his own work, but in his own. So the IT person is doing his own work, but he's not talking to the doctor, etc., etc. So this is in general the situation. Where I think the situation in other countries is the same. We have this transformation. We have a special registry for maternal child health at the primary health care. We have also these initiatives in the hospitals. As Dr. Yusuf mentioned, there are so many initiatives at different stages. They are either at their pilot stage or the completely fully implemented projects. One thing that I would like to highlight in addition to the challenges mentioned by Yusuf, so they're very much similar in terms of infrastructure, training, etc. In Palestine, we have the challenge of having other stakeholders. And other stakeholders, I would say specifically the donors who function and work with humanitarian population or humanitarian settings. And also because the Palestinian Authority is still an authority, so it's mainly depending on international funds. And this has a complete threat on sustainability and building on the different initiatives. And we will come to this later. But one example is Abyssinia, which is the system implemented within hospitals. It was initiated with a fund of one international agency, and then the fund stopped, and the government has to build in because they believe in digitalizing, and it, as mentioned by Yusuf, it is an institutionalized, it's an institutional decision that they want to move into digitalization. It's with how we can continue and maintain. So this Avicenna is the one that was most struggling among the other initiatives, but mainly because of these political and other stakeholders' roles playing on. And another point I would like to highlight is once an initiative started, and this applies to all, we have all investment and well preparation in most of them, training, and then training will stop and they will leave the initiative to move on its own. We have very, I would say, strong limitation in training and capacity building on how to maintain and sustain these initiatives. I will stop here and I will give you more information, just giving some flavors for future questions.
Thank you, Naveen, and thank you, Yusuf, for those comprehensive backgrounds into the situation in both Jordan and Palestine. Now, specifically on the reproductive and maternal healthcare aspect, what kind of reproductive care and maternal digital health interventions are being deployed, and what have been some of the challenges you've identified in relation to the management of the digital infrastructure pertaining to them? Yusuf, maybe you'd like to start.
Yes, thanks again, Laura. Actually, we mentioned that we are having different digital interventions in both countries, especially in the area of reproductive health, and we, highlighted the main challenges facing these challenges. Our project, let me give you some, information about the findings of our research. As Alex mentioned before, our project aimed to understand how existing policies, strategies, and regulatory and legal frameworks regulate digital personal data related initiatives and how they incorporate digital governance concerns of human rights, gender equality, and privacy. Also, we aim to understand the maturity of these initiatives, especially in the area of reproductive, maternal, newborn, and child health services, especially in the fragile context. For this purpose, we developed our own maturity assessment tool, and we assessed 5 selected interventions in both countries, namely Avicenna in Palestine. We also have UNRWA EMCH application. We have also a surveillance system for registering neonatal mortality and stillbirth. And another initiative is MCHE registry in Palestine. Regarding the infrastructure, the selected initiative were somehow mature in ICT infrastructure, despite some complaints of poor internet connection in fragile areas, especially, and lack of regular hardware monitoring and evaluation. Monitoring, maintenance, and renewal of hardware are really inadequate for all initiatives. Avicenna, as an example, financial and political issues, including interrupted funding, are really the main reason for inadequate renewal of hardware. Another aspect of ICT infrastructure is training stakeholders, including who are involved in digital health, including healthcare workers, implementers, and end users. Apart from Avicenna, in which the training and education is very weak, the other 4 initiatives had somehow training and education, but don't support periodic different modes of training. For data governance, because it's a major component in our research, data governance component were less mature than those related to ICT infrastructure across the 5 initiatives. The maturity assessment showed that UNRWA EMCH in Jordan is somehow more advanced than the other 4 initiatives. The governing body, for example, for EMCH, UNRWA initiative, conducts a regular meeting with stakeholders. However, the end users at the clinics were not sure about the development plan, which may be due to the fact that the drivers of data governance planning did not inform the design, implementation, or maintenance of this initiative. Another example, Evicina. Evicina scored very weak and with no governing body, no clear plan or drivers for data governance, or even a specific approved data regulatory framework. This is different from the MCHE registry in Palestine, which had a clear development and implementation plan. The MCHE registry had an established planning process, but with no clearing governing body. When it comes to ethics and human rights, the two UNRWA initiatives in both countries demonstrated adequate maturity in regard to the implementation and training users on the health data security and the privacy laws, development of policies assuring data ethics and human rights. On the other hand, the stakeholders of the MCHE registry and Evicina in Palestine were not sure whether these initiatives reflect data security. Also, there is no clear guidelines or data regulatory framework about data privacy of digital initiatives in general, as well as no regulatory body. The UNRWA MCH, for example, in both countries, demonstrated high level of maturity in data ethics and human rights, which were not incorporated in other digital initiatives. I will give more time, for Niveen actually to elaborate more on the findings of this project.
Thank you, Yusuf. And I would like to just put more context into what you have said, just to make it more reasonable for people to understand these different findings. I would start with the UNRWA initiative. UNRWA initiative, the way it functioned, the design would be at the headquarters in Amman. The implementation will be in the different regions of UNRWA. And this explains why the end users and the people who are the implementers in the different regions in Palestine, for example, and I expect in Lebanon and Syria, will have similar results compared to what was in Amman, where the complete design is. And just to explain more the difference between Avicina, which is the hospital tertiary care initiative, compared to the EMCH, which is the primary health care. One was developed by the different donor, and it was adapted by the Ministry of Health. And then this is when we start to face the infrastructure, planning, governance, etc. issues, compared to the EMCH, which was developed by the National Public Health Institute, and it's still responsible for its maintenance, follow-up, etc. So the governance, to explain what the governing body, it's more clear where the data is going. The same with JSAN, which was implemented. It's a pilot project initiated by university, which is well structured. But when it will be scaled up, we will be facing the question of governance, data sharing, data privacy, etc. Compared to Hakim, which is a private sector, which will focus more on the infrastructure component compared to the governance, human rights aspects. And this will give some background to understand these different initiatives and the variation we have identified within these initiatives. But just to add another point also, the initiatives were at different levels. So they were at the health information system, which is something that is adapted by the government, or that is the government will buy the service, registries, health surveillance system, websites and the YouTube channels that provide this information, but also mobile application and short messages. And these wide variation of the different initiatives that we selected 5 from them was very important to know, to see the wide range of applications that we have and how the data is managed, because at the end, we need to get to the data governance and data management, data privacy, etc., etc. So our finding is showing us that the big initiatives that we were focusing on, they are suffering from some limitation. So we are raising a larger question concerning the other initiatives that are, I would say, not well monitored or followed up by. I would say, well, it doesn't have a clear governance body. Thank you, Yusuf, because you gave a comprehensive. I just want to give some context to some of the points that you have mentioned.
Thank you both. And just to give a little bit more context to our speakers' contributions, we've all been involved in a project funded by IDRC, looking at the governance of reproductive, maternal, newborn, and child health digital initiatives in Palestine and Jordan. So the findings that Naveen and Yusuf have been sharing with us all are the result, or the emerging results of that research. One of the issues which the speakers have hinted at, which we know emerged early on in the project, was the lack of an existing research framework to assess the different components you were looking to explore and that have been mentioned so far in the discussion. So digital maturity, gender, human rights, and privacy. Can you tell us a bit about the process you undertook to develop the methodology and research tools to assess these different elements? Naveen, perhaps you can start.
Yeah. So just to give a quick overview of the whole project, and then I will zoom on to the maturity assessment tool. So for our project, we have to have an overall conceptual framework that guide our research. And it was important for us to identify the issue important to empirically examine and guide the data analysis. So that was an essential thing for us. So this study included a comparative case design at two levels, the cross-country between Jordan and Palestine, but also within country to compare the different initiatives at this level. We studied the study involved three levels of analysis: contextual understanding of the landscape of DPT initiatives in the MENA region, and the national level analysis of the landscape of policy environment around the digital technology, and the micro level analysis of the two ongoing DPT initiatives in each country. So we have these different levels to have this comprehensive view. And I think I will leave the macro level for Alex to get, because she started with it, but I think she can comment on it. But for us, when we started looking at the different initiatives, we looked at different levels. We looked at the initiative itself, but also at the beneficiaries. And with the first looking at the initiatives, we wanted to conduct an assessment of the maturity level. And with the maturity tool, we tried to look with a comprehensive disk review for all tools that were used to assess the maturity level. And I have to say, there were several maturity tools that ranged from very simple, like 6 questions, into very complicated one. The tools were more toward non-health related initiatives, and this was a challenge for us. There were some initiatives that were, some tools that were proposed for health, and they were not specifically answering our research objectives. And that's why we have to combine different components of different tools in order to achieve our objectives. So we developed our own revised maturity tool that look at assess the maturity level and also includes the human right and gender concerns and digital infrastructures. So the tool we have developed, it has 2 major components: information and communication technology, governance, and interoperability component. For the infrastructure, it was clearly looking at hard things like hardware, reliable network and internet, operation and maintenance, training and education, in addition to the continuous education of health professionals or professionals involved in the initiative. And the data governance, it included governance, legislation, policy, compliance, standards, and interoperability, and finally, data quality. So we have to combine to look at both the soft aspects and the hard aspects and try to be as comprehensive as we can. The challenge was to whom to give this tool, because the tools was designed for different people. And for us, we have defined several stakeholders who were involved to answer this tool. And because it's a revised tool, it was built to be as inclusive as possible and fit the needs of all stakeholders. So we managed to identify different stakeholders like developer, system designer, IT and technology support, policymakers and high-level stakeholders, in addition to implementers and end users. Each has his own role and each has his own assessment for the maturity level. And the way we developed collected the data, we had several approaches. First, we shared the tool with the different stakeholders to be self-administered. And then we asked the same stakeholders to have group meeting to discuss between them how to fill in the tool. And I just forget to mention that the tool gave score from 0 to 3, but each score has its own meaning for each component. So it's not one, it's no, and 3 is complete. It's premature until fully mature. And this will be interpreted in terms of each item assessed. And at the end, after we have these self-administered questionnaire and a tool, and then group meeting, we have an overall focus group discussion between all stakeholders to reach a consensus on how we can evaluate or score each component of this tool. It was a little bit complicated process, but I think it gave us reliable information. The challenge was with the tool that was that included the gender and human right aspect, because the concept was relatively new for the different stakeholders, and they couldn't comprehend what do we mean by did you take human right aspect into consideration when you designed this initiative. So this part of the tool was slightly, I would say, premature, and it needs further work, but we have some insight. It gave us some insight about the situation. Hopefully I didn't give you more very technical terms, but I think Yusuf can just simplify it in an easier way.
Thank you. And Yusuf, yeah, just if you could take a couple of minutes so we can get into the approach, that the results from the interviews, that'd be great.
Sure, Laura. Actually, Naveen, covered the methodology used in this study, so I will not take long time to explain. But I want to highlight that, we are assessing, concepts, domains, and dimensions that people in our countries are not familiar with when we talk about governance, when we talk about, human rights, gender issue, intersect. Yeah, we have multiple, vague terms. So the methodology was really complex. So but it's beautiful. In fact, it's really very effective, and I think this is one of the main product of this project is to produce a nice methodology that we develop. So our methodological approach involved different preparatory activities, including contextual analysis for fragility, political economy analysis, stakeholder ecosystem analysis, and landscaping of existing initiatives that deliver our MNCH services. In addition, we evaluated and assessed the existing policies and legal frameworks existing in the two countries. The data sources, they are multiple actually. It was based qualitative in nature, quantitative, by conducting focus group discussions with different stakeholders, key informant interviews with beneficiaries, and we included different multiple stakeholders from beneficiaries, developers, implementers, and policy makers, which make this approach is really complex, but it is unique in its nature.
Thanks, Yusuf. And you've both spoken about the need to gather views from people involved at different levels of the initiatives. So at last, I'd like to ask the panelists, what have been some of the main findings emerging from these interviews you've carried out with users, designers, and implementers of the systems, as well as beneficiaries in particular? Yusuf?
Actually, we paid a lot of attention to beneficiaries, in this project. So in total, we included in our study almost 56 mothers who benefited from one digital initiative that is implemented both in Jordan and Palestine, which is the ANARWA MCH application. The interview with women beneficiaries three main themes emerged. The first theme was women's perceived benefit of the initiatives, how they perceive the initiative. The second theme was about the initiative performance. And the third one was privacy and data protection. Women, in fact, who are using EMCH application in both countries expressed their appreciation of the possibility of gaining knowledge about topics related to pregnancy and their child care. And they describe this initiative as a good source of information. Some women, for example, some women expressed their satisfaction with the services. They especially noted that the waiting time and the consultation time reduced a lot, which is a good impact for this initiative. Also, women communicated that this initiative helped them to track their data in an efficient way. According to the participating women, they benefited from the initiative, as they mentioned, even more during COVID-19 pandemic lockdown, as this initiative provided them with continuous access to necessary information and instruction related to their pregnancies and childcare. When it comes to the second theme about the initiative performance, it was perceived easy to use. The majority, they mentioned that it is easy to use application. However, some women complained of some performance issues related to the stability of the application, technical problems usually like the app freeze and some connectivity problems. The good thing that in this study that we allowed women to make suggestions to improve this initiative. They come with a valid suggestion, in fact. They suggested this app to include facilitation of the two-way communication with healthcare providers, not only one way. They also suggested to incorporate personalized health-related topics developed based on the user-specific needs, not general information. And also to make the initiatives available offline, of course, because of the internet access. Very interesting finding when it comes to the privacy and data protection. Almost all the participant women did not have any concern about disclosing their personal information using this digital initiative in both countries. Many women consider that this initiative safe, not for any reason, but because it was recommended by their healthcare providers, whom they trust most, as they mentioned. They also believe that all data they provide through the initiative are necessary in order to be provided quality healthcare services, and none of which is unnecessary. Women in generally, they trust healthcare staff who collect their information and believe that they will not share their data or show it to others outside the healthcare system. This is their belief. I give more time to Naveen to talk more about, other stakeholders.
Thank you, Yusuf. I just want to add to add 2 points or clarify 2 points. The first one, the beneficiaries, if they didn't have direct contact with the initiative, they wouldn't appreciate that it's an initiative itself. So they would think it's part of the service. So, for example, Avicenna, it's the digital system within the hospital. So it is perceived that this is part of the service, that they will collect information. So when you ask about what is the benefit of it or whatever, they don't have this direct contact or direct benefit from this system. It's mainly the nurse or doctor or health professional who is dealing with the computer and doing all the information. So the women feel slightly disconnected from this initiative. That's why our focus was more on this application that was developed by UNRWA, and this is a mobile application. It is we have all these advantages and themes that came up, and I think we should encourage us to move forward with these applications and messages. But what we need to keep in mind, the availability of resources or infrastructure. So the mobile, is it available with the husband or with the wife? Is it available for the family? And this leads us to different issues related to privacy, etc. But also the connectivity, whether they have continuous connection for internet, etc. And would it be timely use or not? So we need to take into consideration several challenges when future initiatives are being built or planned that we need to take into consideration. Mainly that has to do with human rights in terms of availability of, as Alex mentioned, availability of resources like the mobile, etc., or infrastructure, but also the privacy, given our context. If the mobile it's one mobile for the whole family, and we're talking about MCH services, which have very specific information. This is very important. I think women still perceive this is part of the service. So still they couldn't differentiate whether this is my right or this is part of the service. And this needs lots of work, and this is where the advocacy part comes. I'm not sure how we can do it in our project, but this is one of the things that we would like to highlight for future initiatives. I'll stop here.
Yeah.
Thank you both. And just to launch us into the Q&A session, Alex, can I ask you, what are some of the changes that you have been advocating for as PI, Privacy International, to address some of the issues that Naveen and Yusuf have raised in this discussion?
Sure. Thank you, Laura, and thank you, Naveen and Yusuf, for sharing all those insights from the research that we've been doing together. So in terms of like bringing all of this together, be it some of the positive things, but also some of the concerns that emerge from the findings of the primary and secondary research that was done in the two countries. They really reflect some of the demands that we've been making as part of our work. As access to reproductive healthcare becomes even more digitized and digital, like that trend is going to keep going, we really need to see governments ensure that digital systems are built with people's needs and experiences considered and human rights protected. Linked to what Yusuf and Naveen was saying, and I think particularly the last point in terms of what emerged from the work that was done to engage with beneficiaries and get their experiences of the system. They highlight a few issues around, the digital divide, around accessibility, but also around trust as well that individuals would put into these systems, especially if they're put forward and encouraged and promoted by, their healthcare professionals, as Yusuf was saying, that they trust. So, the recommendation there would be to ensure that human rights due diligence is undertaken, throughout the life cycle of the digital health initiative, from its design, so involving people in the development and the conceptual stage, also in its deployment. The way that a system might be designed in practice might work slightly differently. For example, as Naveen was saying, in terms of the expectation that all these women would have their own access to a mobile phone, for example, whether they have to share it. What does that mean in terms of their interaction with the system? The second point, which I think came up particularly at the beginning of the conversation, was around the context in which many of these have been deployed. There's issues around fragmentation, like of a comprehensive approach to digital health, and particularly the deployment of maternal and child digital interventions in a regulatory void. And so we really need to ensure that there is a strong legal and regulatory framework in place, as I was mentioning at the beginning, to make sure that all of the stakeholders that were mentioned, be it the end users, which is, the medical professionals and healthcare facilities, to the people that are responsible for the design and maintenance of the system, possibly within the, IT systems, as well as individuals, that all of the stakeholders within that system understand, how the system is meant to be regulated, what their obligations and responsibilities to as they're processing people's personal data. And so also that, connected to that, and we didn't touch on this in the presentation, but I think we can have maybe a short discussion, was, this ability also in terms of redress mechanisms, what happens in instances where there is a breach of personal data or misuse or unauthorized access. What is the mechanisms there for individuals affected by those instances to get fair and accessible redress mechanisms? And then the last point, which I came up in the example around UNRWA and the application there, is also to within the broader infrastructure is, what is the accountability mechanism for those non-state actors that might not be subject to national legislation, and what are the rules that they would have to, abide by? And then the last point, because we talked a little bit about research as well, and this came up in a lot of our discussion with Naveen and Yusuf and their teams, is how we can use also these projects to improve the way these initiatives are being researched. As mentioned, we developed a framework because the ones that existed didn't match our needs in terms of what we're trying to assess. And that can be really useful to raise awareness and develop a better understanding of issues around human rights and gender within the public health sector and within those that are researching digital health initiatives as well.
Thank you, Alex. And now I'd like to open it up to both the virtual and physical room. If you have any questions on your mind, you can jump in, perhaps unmute, or alternatively type your questions in the chat or the question function.
Hello, is that working?
Yes, it's working. We can hear you.
Thanks so much, especially for that last piece around advocacy. Because that was that was what I was curious about at the end there, like where's this research going? I guess one thing, so while you were speaking, I was thinking a lot about the principles for digital development published by DAS. It's this framework that's been around for quite a while, and the first principle is design with the user, and then all the way, one of the other principles is I think it's something like take into consideration privacy and security. And at this point, I feel like they're pretty well known by folks who work in the digital development space, including digital health sort of within that. So I'm just wondering, like, what's the disconnect here? Like how, like there's this framework, these guidelines have been in place for a while. They seem pretty well publicized and well known. Yeah, where's that disconnect? Thanks. Oh, and sorry, I'm Sasha. I'm a researcher. I'm based in Amman in Jordan.
Thank you, Sasha. Any volunteers? It's a great question.
Maybe I can start and then see if Naveen and Yusuf want to respond. I mean, you raised a really important point, actually. There, in terms of data governance, there are quite a lot of principles. They're the ones you mentioned, and as well within WHO guidelines as well around the use of digital tools and the use of AI. There are various principles that have been developed there. I think what your question is highlighting is how do these principles that often are very broad and vague, how do they become implemented, and how do they inform the design and implementation of those services? And that disconnect is definitely there. As to, I could hypothesize a little bit as to why that's happening, and maybe Naveen and Yusuf can also relate their experience. But often we don't see those that are designing or implementing those systems going back to those principles. A lot of them are not, they're not binding. They might not have been, informed about them. They might not know that they exist. So there might be a disconnect there in terms of knowledge sharing between, people wider and bigger institutions developing these principles, guidelines, and then in the in the actual use of them, they just don't lead to informed decision making. So I think there's definitely a disconnect there in terms of awareness, but also what are the mechanisms that exist that should inform decision making. And then the other one is what's going on in the national level as well. A lot of these principles or guidelines may request or may say, you need a regulatory framework to oversee data protection or data processing. As to how that's implemented, we're seeing that in different ways, and maybe going a little bit away from the two case studies here. But in other examples, either there's been the development of data protection laws, but it takes, the legislative process takes a long time. And what we see is that they start implementing a system before the regulation is in place. So I think that's also a disconnect in terms of that process of what should come first. And the need or the push at the national level, because there's a digital health agenda or just an innovation agenda, or digital transformation agenda, that's kind of more pushing that aspect rather than focusing on the regulatory framework. I think the other element that Naveen referred to was the different understandings of the different stakeholders. So it was really fascinating, and we're going to have a few papers coming out hopefully shortly on these findings of, we asked the same questions to people that were designing, IT people that were using the systems, and they all have a different interpretation as well. So I think that was also an interesting finding for us, as to within the people that are meant to be working together, different levels in terms of terminology around roles and responsibility, and who will be accountable for what part of the system. So I think in terms of the practical things, linking back to your question, I think there's just a huge disconnect in terms of best practices. And then once a country or a particular stakeholder decides to deploy something, to just fast forward in a way and go straight into implementation without looking at what is that, even if it's soft in a way, a non-binding regulatory framework, what they should be taking into account. But that disconnect is definitely there.
Any reactions, Naveen, Yusuf, from your side?
Yeah, no, I think, Alex answered the questions. The guidelines and the principle now are well documented and available. What we wanted to know actually, how these principles and were implemented on the ground under the context of no digital health strategies, seeing that many now initiatives started to emerge. Do they stick to these principles or the guidelines? This is actually what we did in this project, and we found that there is a big gap between the right approach and what is currently implemented on the ground.
Just one point, if you allow me, Laura, just to elaborate. So our work is exploratory. And when we want to explore, we want to be as inclusive as possible, keeping these principles in our background. And it's there, but it's not enforcing us to look for it. We want to see what will come out. And that's why when we were looking at the different tools, we were trying to be as inclusive as possible to make sure that we are capturing everything. And the disconnect exists because we have the digitalization started way before the policies and strategies. The disconnect between the different stakeholders, they don't talk to each other. So the planning is in one planet, the implementer is somewhere else, and the person who is responsible for data governance is in somewhere else too. So the disconnect is, we have everything on the ground, but it's all random and fragmented. And if we wanted to start with the guiding principle just to look whether it's there or not, I think we would be limiting our finding. But we want to be the more inclusive and exploratory to see what will come out. And you can see nicely hopefully when the people come up. The EMCH, the one that was developed by the National Health Institute, it's following exactly the principles. It started with, it's well developed, it has well governance, implementation, the training, the connection between the different stakeholders compared to the other initiatives. So I think we didn't ignore the principles; they were in our back mind, but we wanted to be as inclusive as possible to see what's there.
Thank you both. And I think we might just have time for one more question. I see some movement, but I can't quite see if people are sharing mics. Please do shout if you have a question.
No more questions from our side. I guess so. So you mentioned the paper. Just when will that be released?
Oh, sorry. Go ahead.
Oh, thank you. The maturity level was published yesterday, so it's out. But the beneficiary, it's the mapping one that maps all the initiatives, which is, I think it's very interesting one that you should look at. It's under review. And we have one looking at the gender and human rights aspects, inclusion within the different initiatives. And the last one is looking at the beneficiaries perspective. But if the times allow, Laura, I would like to ask advocates to take this message with you and see how you can advocate, but also how you can advise us to take and use our results and help and better plan new initiatives. So it's a message for you, I think, and I hope I can have a quick response from your side.
Thank you, Naveen, for that call to arms. So something to think about as you all go back to work and potentially revisit the findings of the wonderful article that Yusuf just shared in the chat. I think Ginwa had asked for it. It's now there. So if you refer to the chat, you'll see the link to the latest paper. But as was mentioned, there are more on the way. So stay tuned. And Alex just shared a bunch of resources that you might find interesting to delve into as well. I think that brings us to a close then. Thank you everyone for joining, for your questions and for your interest. And we hope that you enjoy the rest of Bread and Net, which is far from over. Thank you in particular to our panelists, so Alex, Naveen, and Yusuf, who joined us from different time zones and who put up with our hectic emails and organizing in the lead up to this event. Thank you so much for your time and sharing your expertise.
Thanks, Laura.
Thank
Thanks.
you, everyone.
Thank you, Laura.
Thanks to the audience. Bye-bye.
Thank you, audience.
Bye.